Hi and welcome to The Nation. Joining us on the show today is Yang Berhormat Dr. Siti MARIAH binti Mahmud, Chairman of Standing Committees for Public Health, Unity, Women and Family, as well as Chairman of Wanita Berdaya Selangor. Today's topic will be about Talian Selamat, an initiative that the Selangor state government will undertake through Wanita Berdaya Selangor. Welcome to the show, YB. How are you?
Fine, thank you, Sonia.
It's such an honor to have you with us here today. But before we go any further, YB, perhaps could you share a little bit of introduction to what Wanita Berdaya Selangor is all about?
All right. Wanita Berdaya Selangor is what I would say that it's equivalent to a Jabatan Wanita for Selangor. It's a women's department in Selangor. You see, before we had various programs and various organization or agency that is under the purview of the EXCO, women for women. So what we did is we put them together so that it is managed under one in one entity, that is Wanita Berdaya Selangor. Before Wanita Berdaya Selangor, we already had what we call Institute Wanita Berdaya, which is basically a think tank plus a research body. And then we had Pusat Wanita Berdaya, which is 10 years old already, which is based on building capacity and teaching skills for grassroots women. And our latest edition was Academy Kepimpinan Wanita, basically training women to lead, in various organizations and wherever they are, is open to the public. So what we do is for implementation and easy for us to really evaluate, we put it under one roof, Wanita Berdaya Selangor. It is a Sendirian Berhad non-profit organisation and is put under Menteri Besar Incorporation. So basically, Wanita Berdaya Selangor, we are bringing all the programs that Selangor has initiated since 2009, to put it together, and so that we can work coherently and do a better job at this, And for me, the institutionalization is very important because EXCOs will come and go. EXCOs will come and go. And therefore, the continuity of what we have started since 2008 must move ahead under with clarity and with purpose, So that is very important. So this is what Wanita Berdaya Selangor is all about.
Interesting. Good to know that you've got a lot of various programs as well as initiatives that are being introduced. But perhaps, under the objectives of what Wanita Berdaya Selangor, what does it comprise of?
We have three main, what we call tumpuan, main focus. One is research and ideas, churning of ideas for women, and we engage with many NGOs to see there are so many things to do. What should we prioritize? So we do not do our work alone. We engage the activists, we engage NGOs, we engage people at large to listen to them. And the other one is, of course, the empowerment of women, which comprises so many things, from economic to health, to good governance, to politics. So there is a lot of component in empowerment for women. And of course, health is now becoming very important. And of course, I always say that we have to prepare a critical mass of women leaders at all levels. So in order to prepare this critical mass of women leaders, the state must move forward in allowing women to come forward to be trained. These are people who have worked in the community, and some of them are with academic qualifications, some of them don't have it, but leadership is not about academic qualifications. It's about, for me, it's about giving them the chance to be trained and to be exposed to issues, women issues, which they should take up seriously when they are at the community level. So we want women leadership to be at all levels of the state government and in all community, because then only we can bring our ideas together and move forward as one, what we call it.
And I couldn't agree more with you, what you said there about leadership, YB, because I run a leadership training consulting company myself. And, I understand that leadership is actually a skill that can be trained and that can be instill, right, in a person.
Right.
So I understand that, one of the main goals for Wanita Berdaya Selangor was to improve the socio-economic status of women. And it's
Yeah.
also good that you have all kinds of initiatives to accelerate women's leadership as well as decision-making capabilities. But that is quite a list that you have there. Perhaps you can share the latest initiative or program that you have right
All
now.
right. Okay, this program is actually at the suggestion of our Menteri Besar when he announced it in our package Selangor 2, rancangan package kita Selangor 2 in the middle of this year. We already know about the problems of keganasan rumah tangga or domestic violence, and we know many NGOs are involved in this. However, Selangor felt that as a state government, where we can network with the state agencies and all government agencies to give a better support for these women. However, when we talk about Talian Selamat, of course we have that tali 911. No, not 911.
We have befrienders, we have Talian Kasih. I mean, you're right. There are a lot of NGOs.
Yes. But Selangor felt that we have to have one that's under the Selangor government, because as we get into it, we'll know much better which agencies should we pulled into it with us to work together. Not on I like it, I will join you. No, but this is like, okay, I want JKM, I want police, I want MAHMUD, JAIS, and all agencies under the government to come together to look into this matter. And I felt that, however, this Talian Selamat is a place for them to share their problems and we to guide them in a way to solve their problem. But however, personally, I felt that this is already at the end of the problem. They are coming to it only when they are having problems. Therefore, it is not. We are dealing with the tip of the iceberg.
Exactly. I mean, you're right there, because there are so many other prevalent issues when we talk about, during the pandemic. Mental health is one, domestic violence is one, depression, So why domestic violence, if you don't mind me asking? I understand Talian Selamat main focus is on domestic violence.
Well,
perhaps you can...
Yeah, we hope to focus on domestic violence. However, we know we're going to get all sorts of calls. Yeah, but of course we'll sort that out at that level. Because we already have Talian, we call it Sehat program, which is a mental health program, which is also online, which are providing to the state, to Selangorians, that they can talk about their problems if they need counselling and so on and so forth. But Talian Selamat basically would like to focus on domestic violence, because entangled with the domestic violence legal issues, there will be also support issues that we need to look into, and there will be also what we call advocacy issues, training issues, that the state government has to look into and put them in the various programs that we are having. For instance, a campaign for domestic violence. We have been doing it for a few years, and we are doing awareness programs at the grassroots through our Pusat Wanita Berdaya. And then we bring them again in Akademi Kepimpinan Wanita. And then we talk about the laws and what we should do it. But I feel that after this, we have to focus on preventive rather than just dealing with the tip of the iceberg. How do you deal with relationships and all and so forth? I'm quite concerned about. I think one of the reasons we have is because our social structure has changed from an extended family to what we call a nuclear family. Now, parents are far away, aunties and uncles are no more around you, and you are solving your, a nuclear
your
family.
Own household problems, right? You're so isolated from your other family members.
Yeah, that's the issue. I think that things would be much better if you have extended family around.
Exactly, because they provide as a support system, right?
Yeah, the support system. The lack of the support system is one of the issues, especially during our MCO, during our pandemic, when they are closed, they cannot get away, they cannot, and with not working, with financial problems, that is
exactly.
one of
And some figures that Dewan Rakyat shared with us, was that domestic violence consists of 9,000 cases, since the pandemic started up till August. So that is very worrying indeed. But perhaps maybe you can enlighten us some of the true reality that occurred when it comes to domestic violence. I mean, you talk about, people have moved on from having that social support system within their extended families to now being just isolated, right, on their own. But what are the things that are causing domestic violence to increase?
Before we go to the causes, I do feel that people who enter marriage never had domestic violence in their mind. They would think that this will not happen to them. They've heard it. But I think mentally, women and men have to be prepared that this can happen even when your marriage is out of love and you choose your partners, but things can go wrong, and they have a problem, I think, of conflict management, stress management, and when you have so many challenges at one time, when they cannot deal with such, and then of course added on into financial problems that cause stress, that cause depression, that cause along, so they do not know how to tackle it, because actually the best form of prevention is to recognize the symptoms early. But how many people would want to admit that we have a problem? We have a problem. I have a problem. My husband has a problem. I have a problem dealing with this.
That's an interesting fact that you actually shared with us there, to recognize the symptoms early. But what are the symptoms that we should be looking out for? Because sometimes we say disregard the symptoms thinking it's normal. So perhaps you can also share, what are the symptoms that we should be looking out for?
Okay. Before you know the symptoms, that's why the awareness must be there. The mental health awareness must be there. Many people deny they are in depression, they are stressful, they are anxious. So when you don't want to, I'm okay, I'm all right, I've been tackling things for so long, and what we should instill in people is that there is nothing wrong to admit that you have a problem. You need to tackle the problem. And who shall we go to when we have these challenges? Then only we talk about the symptoms. How do we recognize it? So the awareness program has to be to me, I said, to have to be put in early in life. Perhaps when you are a teenager, when you're leaving school, things like this, awareness should come in early. We should discuss about domestic violence openly, and children of domestic violence should also have a way out of expressing themselves, what they are seeing. If they do, I don't want them to go. I don't want the children to have that. Oh, this is normal. It is acceptable. It is not acceptable. I used to, when I was younger, I used to say to girls who are getting married, sometimes I give them funny advice before they get married, because I had a funny advice too from my mother, late mother. I didn't understand it when she said it to me before. Don't let your husband hit you. If he hits you, walk out. At that time, I don't know anything about it. I was a teenager. I married early. But that was one of the things my mom told me. So
exactly, because that is such a strong message from them as well.
It's a strong message.
Because the moment they raise a finger on you, that's when it can escalate. Things can escalate. It can escalate.
If you let it happen once, twice, and you do not take any actions to prevent it, or be assertive enough, or take advice and acquire skills. How do you tackle with it? Such things as how do you tackle a person who's angry? Sometimes these tips are very important. That's why the extended family, the advice from an elderly extended family is good. We don't want people who becomes what we call put in oil in the flame, and it will get back. Okay, if he hits you, you hit him back.
Exactly, and some of us tend to just sweep it under the carpet, right? Because we think that is our role as women, right? Men are supposed to be,
because you see the complications is large. It's easy to say for a woman, walk out. How can she walk out when she has 3 children? She just cannot walk out. You see, so there is no more value. I think if the walkout business is before you have any children, But once you have the children, then you have other things that you have to
Exactly.
think about.
You have to consider about your financial
Yeah.
status,
Financial
being a
status,
provider to your
and if you're
children,
not
the mental
working,
health.
and all, yes. So the other thing is that right now we are handling only women. Women come to us, and we tend to give them a tip what to do, and if they need an IPO, we do that. But I think we are not tackling the husband at all.
Right, so it should be two ways here, right? I
Should
mean,
be
we're
two ways.
talking
We
about
cannot.
number one, empowering women, but honestly, if you're asking me, why that is a good step. I mean, the first step, as well as the approach that you're handling on the ways that you're handling.
Your voice has gone. So that is some of the things I think we have to be realistic. Sometimes times have changes, but human behavior is still the same. So that is where we have to really engage people who are more experienced to share with us the tips, and also what we say there, to share their life, how they negotiate life and how they get through life. I'm quite keen on this thing about life negotiators. Yeah, how you train women
Can you
to
hear me now?
yeah, I can hear you. Did you hear me
Okay.
just now?
Yes, I heard everything. Don't worry
Okay.
about it. Yeah.
So I'm keen to have, later on we should train people. Maybe they're counselors, maybe they're not counselors by qualification, but women who can help other women and family to negotiate life. It's no point if you go, because we heard when we go to a certain institution, when the wife complains about the problem they're having, with the husband, and sometimes the husband hit them, and some advice is like, okay, you must be patient, sabar, reda. That's the word I think the community sometimes uses. So we don't want that type of advice anymore. We don't want that type.
Exactly, and that's why it's so important to also create that awareness, to seek professional therapy, to seek professional counseling. But why that leads me to my other question, right? We've seen the latest figures that Health DG mentioned. We only have one psychiatrist in 100,000 people in Malaysia. So that is very concerning, right? We don't not have enough trained people to actually give proper professional advice. So how are you overcoming this issue, especially since you established Talian Selamat?
Okay, what we are going to do, what we have in mind to do, we're already working on our Sehat line for those with mental health problems, mental health challenges, to connect to the existing whatever psychiatrists we have. They may be in the government sector and they may be in the private sector. So we have to build these bridges with them, and the state will look into how we can engage them. For them, we will have to think about the funds available as well, because we are taking their time, their professional time, and so on and so forth. It also applies to mental health. This is also been requested to us, but of course we have very limited funds for continuous what we call continuous counseling, because this
exactly, and none of us saw it coming, right? We never realized the pandemic was going to hit us, and we never realized, all these issues like mental health would actually, we talk about there's the health issues of getting COVID, but this aspect of mental health is also on the rise, causing suicides, suicidal thoughts, like you said, domestic abuse. Am I right?
Right, true. So these are, you see, we are nowhere there to connect in the sense that our queues are very long for to see a clinical psychologist or a clinical or to see a psychiatrist. They have to be referred by doctors, and of course you see the medical officers first before you get to see a psychiatrist. We really hope that this profession is very important now. I think we have a handful of clinical psychologists, but state is actually what we are doing. We're helping counselors to upskill themselves so that they can also take up cases, other cases rather than the normal counseling for certain. There are so many things a counselor can do, but they need upskilling so that they can handle many more variety of cases. Yeah. And we actually, on the state level, we have about 30 over counsellors, through the line, Sehat line. That is the line specifically for mental challenges. But we are going to connect them if they need prolonged
treatment
counseling,
or consultation.
they need to express themselves, and the intention of the state is at the end. That's why I say at the end of the day, when we do it, formalize it as a state agency, therefore we can connect ourselves to Jabatan Kesihatan Negeri, we can connect ourselves to Kementerian Kesihatan Malaysia, and other organizations to help us channel these people. Yeah, hopefully we can do that, but I'm not sure whether they are overloaded or not. So this is another issue that we have to, I think the importance of mental health is I think now is most people talk about mental health, the importance, but I think we are not prepared to handle the surge in
Exactly, and those are issues that are being overlooked. The number of psychiatrists as well as therapists that we have, the awareness of it as well, right? And I guess society play a huge role in this because there's only a handful of psychiatrists and therapists we have. And it's interesting to note that, Wanita Berdaya Selangor have initiated Talian Selamat, we have Befrienders and Talian Kasih and things like that. But are such efforts enough, Doctor? YB, where do you see the progression of Talian Selamat heading?
You see, we are going to be officially starting our program on the 1st of November. It took quite some time for us to set up Talian Selamat, and I would say that the first few months will be us piloting through and really going on ground, understanding. I mean, Befrienders have been long there, Talian Kasih has been long there. I also know that Talian Kasih at the end will channel them to JKM, and then also to WAO, and then to the more experienced NGO. But we hope to create more people involved in this. Definitely, we have started with WAO, this Community Selamat, where at the PWB stage, we are training support groups at the community level. So if we can create what we call Community Selamat, or this group of volunteers at the community level, so at least the first line of help is there. Not everybody needs specialized help, but they need the first line of help. As I say, that they must have support groups in the community where they can come and they can express themselves without people, the whole kampung or the whole community knowing about their problems. So this is a real problem of our community at times, that people do not want to talk about their problems because the people do not respect privacy. People's privacy, and soon everybody knows, okay, this fella has been, it's not healthy. So we have to create this sort of community whereby people can trust them, come to them, and they will help to figure out a life negotiator. I call them, I would like to call this term, I think, help them to negotiate their life, what
exactly. And having the support groups helps, because sometimes you are in a circle of people who are also facing the same issues. So I can really see a direction.
But of course, these are ideas which we need to translate into actions. How long we will take, and that will need the commitment of the state government and people who are involved in Wanita Berdaya Selangor. So I do believe whoever is the coming EXCOs for Wanita will take this up seriously, and we'll see a progress towards it, and not just, I don't want to, 2 years from now, 3 years from now, we're still talking about advocacy, we're still talking about, we are not from Talian Selamat, and what next, Talian Selamat? We don't have anything additional. That would be a shame, if we do not progress from where we are.
Exactly. But it's a good first step. I think in a way the pandemic has made us realize, the crucial, the serious severity of, mental health as well as domestic violence. Now, lastly, YB, we only have a couple of minutes left. What would your message be, to all our viewers there who are experiencing domestic violence or mental health issues? What are some of the awareness or message you would like to send out to them?
I guess for those who have already have experienced domestic violence, definitely you have to talk about it. And we have to come together and put and share experiences. Some people can get out of it and they have their tips for us. They have what we call life lessons, yeah, to share with you, which you can experiment it out and use it. But if you don't come to us, you wait till then at the end of the spectrum, which is about too late, to do things, and you may end up in divorce, and after that you have other problems, and we cannot help you any further because the family has broken. You see, most women with domestic violence, going through domestic violence, divorce and separation is the last thing that they want. How to solve the problem unless it is really, really bad. They will tolerate as much as they can. I mean, but they must have a limit. They
Okay, I
must know
couldn't
that-
agree more with you, YB. Of course, to all our viewers there, reach out if you have any problems. And of course, looking forward to the launching of Taliat Selamat that's happening on 1st November. Well, thank you so much for sharing your insights with us
Thank
today,
you, Sonia.
YB. Unfortunately, that is all the time that we have. My name is Sonia, signing
you for
out
having me,
of The
Sonia.
Nation.
Thank
Thank
you.
you.